Hello, I'm Laura Weston, Lead Infection Prevention Nurse for Wye Valley NHS Trust, and I'm also a peer vaccinator. We care for our patients and put a lot of measures in place to ensure that we prevent them from catching infections. We're bare below the elbow when we go into wards, we wear PPE when we're doing clinical practice, and we ensure that our environment is clean. But one thing we don't tend to think about is flu, and just because we can't see it doesn't mean that flu isn't there. The flu virus can actually incubate within your body for 1 to 4 days after you have had exposure, and actually your symptoms can start within about 2 days. Many of us have had flu, so we don't tend to think that it's that serious, but actually flu can kill. And last year alone, nationally, there were over 1.6 thousand deaths from influenza. And this is obviously a great concern when we have patients coming into hospital that are already unwell, and the last thing we want to do is to see them getting infections from being within the hospital setting. During the winter of 2018 to 19, so that was last winter period, we actually saw in Wye Valley 181 patients were admitted with flu. Unfortunately, 8 of those then had to go on to be admitted into ITU. As frontline NHS workers, we are more at risk ourselves of catching and also passing on influenza to our family members, our colleagues, and also to our patients. And a lot of people who have had influenza are not actually ill themselves, and you don't realise that you're transmitting it to your loved ones, your colleagues, and from patient to patient. The best possible protection we can have as healthcare workers is to get vaccinated, and this is why the infection prevention team have become peer vaccinators. This means we are able to administer the flu jab alongside our health at work team and promote the importance of having the vaccine to all of our staff. This will actually increase the opportunities for staff to get vaccinated in their workplace. They don't have to go off their unit to get the jab. And we will be able to provide them with the information and guidance on the flu vaccination. The impact of last year's winter flu outbreak was greatly reduced when 69% of NHS staff from Wye Valley had the flu jab. We're aiming to improve that this year and try and meet the national target of 80% of our staff getting the vaccination. There are actually a number of peer vaccinators across the trust, and I encourage you all to seek out your peer vaccinator and get vaccinated for yourself, for your colleagues, and for your loved ones and patients. And also, do remember, if you do have a cold or a flu, catch it, bin it, kill it. When you have a cough or when you sneeze, make sure you catch it in a tissue and you dispose of it immediately afterwards and clean your hands. And try not to visit any clinical areas if you are feeling unwell. If you suspect you do have influenza and not just the common cold, please do not attend work and notify your line manager immediately.